Human metapneumovirus HMPV is a respiratory virus from the Pneumoviridae family, first described in 2001 when it was isolated from the respiratory tract of children from Netherlands. During the sixth wave of COVID-19 in Spain from November to December 2021, an unexpected outbreak of HMPV occurred alongside the usual RSV epidemic. This HMPV outbreak affected older children than usual, leading to a more severe clinical course with higher rates of hypoxia, pneumonia, and PICU admissions than in previous years. It was quite the unexpected twist in an already challenging time for the country's healthcare system. Human metapneumovirus or HMPV is a significant respiratory pathogen characterized by its single-stranded SS, negative sense, and non-segmented RNA genome, which is approximately 3.3 kilobases in size. This virus belongs to the family Paramyxoviridae and is classified under the genus Pneumovirus. The HMPV genome encodes 9 structural proteins which are crucial for its replication and pathogenesis. HMPV spreads primarily through respiratory droplets released during coughing and sneezing, and it can survive on surfaces for limited periods, making hand hygiene important for prevention. Reports of a surge in human metapneumovirus HMPV cases in China have drawn comparisons to the earlier days of the COVID-19 pandemic. Public health experts emphasize that there are significant differences between the two situations. Chinese health authorities have reported a rise in HMPV infections, particularly among children under 14, especially in the northern regions. The increase aligns with the seasonal patterns typically for respiratory viruses during winter and early spring. HMPV has been recognized for decades and is commonly associated with mild respiratory illnesses. In contrast, COVID-19 emerged as a new virus with no prior immunity in the population. Human metapneumovirus HMPV is a common respiratory virus that typically produces mild cold-like symptoms like coughing, wheezing, or runny nose, and a sore throat, with most individuals being infected before age 5 only. While generally mild, it poses a greater risk of severe illness for young children, older adults, and individuals with a weakened immune system. So, human metapneumovirus HMPV currently lacks a vaccine, making it crucial to adopt preventive measures similar to those for other respiratory viruses like COVID and influenza. Emphasizing hand hygiene and minimizing close contacts with sick individuals can help the risk of HMPV infections. While lessons learned from the COVID-19 pandemic can inform our approach to managing this virus, ribavirin used both orally and aerosolized in conjunction with intravenous immunoglobulin IVIG has been investigated as a potential treatment for severe human metapneumovirus HMPV infections. Both agents may support antiviral activities and bolster immune response, potentially improving clinical outcomes in affected patients. particularly those with weakened immune systems or severe respiratory systems also. However, clinical efficacy and safety profiles should rigorous studies to establish the standard treatment protocols to reduce your risk of contacting metapneumovirus HMPV and other infectious diseases. It is essential to follow several key preventive measures such as wash hands frequently with soap and water for at least 20 seconds, especially after coughing, sneezing, or being in public spaces. If soap and water are unavailable, use alcohol-based hand sanitizer with at least 60% alcohol. I have kept portable hand sanitizers as usual. We will fill it with sufficient amount of alcohol-based sanitizers in few days. Avoid touching your face. Refrain from touching your eyes, nose and mouth with unwashed hands to minimize the risk of infection. And you should also follow all kinds of respiratory etiquettes also, similar to those which were being followed during COVID-19. Cover coughs and sneezes. Allow your mouth and nose with a covering tissue or your elbow when coughing or sneezing like that. Dispose of tissues immediately to prevent spreading of germs. You should also wear a mask in crowded or poorly ventilated areas, especially if you are sick. This helps prevent the inhalation of respiratory droplets that may carry the virus. And it is a common sense that you should follow all measures of social distancing by avoiding close contact and keeping safe distance from individuals showing symptoms of respiratory illness such as coughing or sneezing. And moreover, if you are sick, you should stay home to prevent spreading the virus. Limited exposure in crowded places should be followed during peak respiratory illness season to reduce the likelihood of exposure to viruses.